Just tumor bleeding. What are the risks in stomach cancer? Imagine a tiny tumor in the stomach that starts causing trouble by bleeding. That's often what happens with gastrointestinal stromal tumors, or GISTs, which can develop in the stomach wall. These tumors are known for their tendency to cause bleeding within the gastrointestinal tract, and that can be a serious concern. When a GIST in the stomach begins to bleed, it can lead to a range of complications that requiring quick medical attention. The bleeding happens because the tumor can invade nearby blood vessels or erode the stomach lining, leading to blood loss. This might show up as vomiting blood, which doctors call hematemesis, or black, tarry stools known as melena. Sometimes the blood loss is slow and causes anemia, making you feel weak and tired over time. The risks linked to bleeding from a gastric GIST are significant. First, there is the danger of sudden and severe blood loss, which can turn into an emergency. Patients might experience symptoms like dizziness, weakness, or even fainting, and need urgent treatment such as blood transfusions or surgery. Second, bleeding from a GIST can be a sign that the tumor is more aggressive. Studies show that patients with bleeding tumors tend to have a higher chance of the tumor coming back after treatment and generally have a poorer outlook. This is because bleeding may indicate that the tumor is larger, more invasive, or has ruptured, all of which can worsen the prognosis. It's also important to note that GISTs outside the stomach, like those in the small intestine, tend to bleed more often and can be harder to manage. When a tumor ruptures, it can cause bleeding inside the abdominal cavity, leading to a condition called intraperitoneal hemorrhage. This situation is very serious and often requires emergency surgery to control the bleeding and remove the tumor. Bleeding can also complicate surgical removal of the tumor, leading to longer hospital stays and additional procedures like blood transfusions. After surgery, patients need close monitoring to prevent further bleeding or complications from tumor rupture. In summary, bleeding from a stomach GIST is a warning sign that the tumor may be more dangerous and that the patient faces higher risks of serious health issues. It highlights the importance of early diagnosis and prompt treatment to control bleeding, remove the tumor safely, and reduce the chance of the tumor coming back. Anyone experiencing symptoms like vomiting blood or black stools should seek immediate medical care. Healthcare professionals will tailor treatment plans to each individual, aiming to manage bleeding effectively and improve outcomes. Remember, staying informed and working closely with your medical team is key to navigating these complex situations safely.